Hello and welcome. I'm Dr. Frances Willis. I'm an educational psychologist. In this presentation, I want to share with you about individual healthcare plans, which are also called IHPs, so that you know what they are and how they're used to support children and young people in Leeds who have lifelong medical conditions and health needs. So in 2015, the Department for Education stated that children with medical needs should be fully supported so that they can play a really active role in school life, remain healthy and achieve their academic potential. So really thoughtful planning is needed in order to achieve this. For many children that have medical needs, an individual healthcare plan is a really excellent tool, and it's best practice really to support reflective conversations and enable really quality planning. IHPs are used to bring together advice from health and also education professionals into one document, and that's obviously personalised to that child by thinking very carefully about how to access their views and also the views of their family who know them best. The individual healthcare plan has several aims, so that's initially around recognising health needs that child has. These could be diagnosed health conditions or perhaps medical needs that are under investigation. It needs to agree a daily medical care plan, such as if there's additional monitoring that's needed, equipment, daily medication. Of course, really important in terms of safety is to have a clearly agreed plan for if there is a medical emergency. So beyond keeping the child safe and well, the Leeds IHP supports thinking about how their medical needs affect other areas of their life, and what can be done to help them really thrive. And the last point here is that the IHP aims to be a planning document which really supports and identifies what support is needed for this child. So that could be at all three levels. So for example, specialist, which could include a carefully monitored diabetic friendly meal or perhaps a wheelchair training course, but also provision within a school that's part of their offer for all children who need that little bit more, that targeted support, which could be a sort of a friendship intervention or to have an enhanced transition to high school, for example. And as well as that, it's really a useful way of having a think about what is part of the universal provision available to all students, which is particularly important to that child. So that could be something as simple as being supported to make their own choices, or having someone at school to really listen to them when they're feeling stressed, and particularly in relation to their medical needs. Anyone who's involved in the care and support of a child's medical and educational needs can collaborate on an IHP. It's usually held by the school's special educational needs coordinator, the SENCO, because they know an awful lot about reasonable adjustments that can be made and what support package the school can put in place. So they often manage the process. But an IHP is reliant upon everybody involved bringing their own expertise to the situation. So health advice might come from a paediatric consultant or a specialist nurse who experiences lots of children with these needs and has some ideas about what support might be needed from that perspective. From education, the class teacher or teaching assistants, external professionals such as those from educational psychology or Senate, whoever's involved, and can focus on those educational needs. So parents and carers are absolutely key to a successful IHP, as they understand how a child's medical needs affect their personal experiences. So parents are likely to have a very detailed understanding of their child's medical history, and they have experience of meeting the child's medical needs across different contexts, which is really a helpful perspective. In order to make this an individual healthcare plan, obviously children and young people need to be at the centre. So they need to be supported to contribute their views and share what's important to them so that this can be prioritised in any sort of action plan. The adults around the child do have a role in supporting that child's agency, to ensure their voice isn't lost in the process. They, especially older children as well, really should be encouraged to, be a part of the process and contribute to the process, particularly when we're thinking about children aged 14 plus who are preparing for adulthood. An IHP can be reviewed at any time, but might be particularly helpful to review it at points of big change. So that could be when medical needs change, which can happen very suddenly sometimes, or when you're preparing for big transitions or big changes in their life, like changing schools or moving house or whatever it is. So by keeping all the information in one place, an IHP aims to reduce duplication. And it's a document that should really travel with the child through their education as they get older. Beyond thinking about your child's safety and health, the new Leeds IHP template supports conversations around all areas of a child's life that might be affected by their medical needs. So the areas that are covered include their social experiences, their emotional well-being, experiences of learning, inclusion, and about their experience of having their medical and personal care needs met within school, independence for the future, and also their identity. So these are just really, really big topics, but they are important if we want to support children holistically. So for each of these different areas, the IHP provides a list of questions, conversation starters, to help people really reflect and proactively plan. And so these might not have all be of importance right now, but overall, conversations around these will allow for better planning, identify if there are reasonable adjustments that need to happen, or if there are specific targets that the child should be supported to work towards. We've also produced an example provision map, which shows how these needs of different areas can be met through that universal, targeted, and possibly specialist provision within a mainstream school. This is an example of the types of questions that are included in the IHP template to prompt conversations and planning around different areas of need which might be affected by medical conditions. So identity, how do they understand their medical needs? What words or labels they feel comfortable using to describe their needs? Are these different from the words and labels that are applied to them? How do they want to talk about their medical needs, and who do they want to share it with? And what is their awareness and feelings about difference from their peers, and how does it affect them? So obviously these are really big questions, but they are detailed questions so that they can elicit really reflective quality answers that make you think about what a child needs in order to not just be healthy, but to be actively involved in all aspects of school life, to have independence and obviously to achieve. So it might be that some of these questions are not as relevant right now for this child's life, perhaps in early years where they want to really make friends initially. Maybe you focus more on some of those skills and some of those questions about social experiences. Perhaps later on there are more concerns about children dealing with these complex feelings of difference. So you might think a bit more about identity. So overall, the idea is to have questions which really prompt lines of inquiry and curiosity about this child's experiences and what they need in order to thrive. A range of different plans are used in Leeds in order to meet additional needs. As well as the IHP I've been talking to you about, you might have heard of EHCPs, which is the Education, Health and Care Plans. So I wanted to provide a little bit of clarity around this. So both documents are similarly designed to recognise a child's specific needs and plan how to support those needs to identify provision. In Leeds, neither the IHP or the EHCP, neither document is related to funding, as this is a separate process called FFI, which is Funding for Inclusion. So the key difference between the two main documents is that one is statutory and one is non-statutory. So first, talking about the EHCP, the Education, Health and Care Plan. It's a statutory legal document. It's written by the local authority. An EHCP needs to be applied for, and it will be agreed if it's found that the plan is necessary in order to meet the child's needs, for example, in order to access a specialist education setting or to be protected to access education beyond age 19, for example. An EHCP is quite a long, it's a 20-week long process, and if it's approved, then changes can only be made following a formal annual review. So that's the EHCP. So how is the IHP different as a non-statutory document? So it actually comes with some advantages in being non-statutory, which is a non-legal document. It means that as soon as a child is identified as having medical needs or health needs which affect their education, then you can start collectively writing an IHP for them. It doesn't have to be written all at once. Perhaps they have a medical condition which requires an emergency plan to be written immediately for safety, but then the really powerful reflective conversations about the child's experience of having medical needs can happen over time, perhaps tackling different topics at different reviews based on what feels most important to that child right now. So as a non-statutory document, an IHP can be really, really responsive. So you can review it and adapt it whenever necessary. And for children with medical needs, this can be when a medical need changes suddenly or progresses or develops in some way, or ahead of an upcoming transition, such as moving to high school. For most children who have medical needs who are within a mainstream school, an IHP will be the most appropriate in order to recognise their needs and to plan provision to support them. Ultimately, it's about having the right plan in order to make a positive difference for that child. I hope this presentation has helped in your understanding of IHPs. Please do have a look at more information that there is on the individual healthcare plan page on the Leeds for Learning website. So on here you'll find the newly updated IHP template, so an example provision grid, a 1-minute guide, as well as lots of useful guidance for families, schools and health professionals around how attendance relates to IHPs. And finally, there's some fantastic detail on there about the original project from the Leeds Hospital Youth Forum, the In Our Shoes event, which was part of what initiated some of the work on the IHP to fulfil the needs and hear the voice of young people with lifelong medical needs. Thank you for listening.